Okay, let's go ahead and get started. Welcome, everyone. I'm Jenny Miller, the Executive Director of the Global Climate and Health Alliance, and welcome to the sixth session of GCHA's pilot course, Global Engagement on Climate and Health. Welcome to those of you who are registered for the certificate course, and also to those of you who are joining us just for this session. We're happy to have you all here today. You can find translation for interpretation in Spanish and French by clicking the globe at the bottom of your screen and selecting the language you'd like to follow. And I'd like to remind our speakers to speak a bit slowly because it makes it easier for our interpreters. So today's session is Advocating for Climate and Health Action, the Essential Role of Evidence-Based Policymaking. And I'm really excited to be hosting this session in collaboration with the Lancet Countdown Initiative, because the Global Climate and Health Alliance advocates for climate policy to benefit health. We rely heavily on strong evidence. But unfortunately, there's a lot of evidence that's produced that just it sits on shelves. It doesn't make it to policymakers. And meanwhile, there are policy decisions being made that are unfortunately being made in the absence of evidence. It's not automatic that research actually gets to those policymakers that need to hear it, that want to do good policymaking. And so there actually it requires some deliberate thought and some deliberate effort to get that evidence into the hands of policymakers in the form that they can use. One of the things that's remarkable about the Lancet Countdown is that from the get-go, it has recognized the importance of not only collating, producing that kind of evidence, but also putting it into forms that are useful to policymakers and thinking about the mechanisms by which that evidence gets into the hands of policymakers. I would say many of us are still learning how to do this better. There's much to learn about it. And fortunately today, we're going to hear from some speakers from the Countdown who have been working at that interface of how do we get that evidence into the hands of policymakers in ways that they can use. Our first speaker, I'm very pleased to introduce, is Camille Oliveira. Camille is a policy professional with a background in research and advocacy in a range of areas, from women, peace, and security to Indigenous education, and now climate change and health. She holds a Master's of Philosophy in Multidisciplinary Gender Studies from the University of Cambridge, where she explored feminist and decolonial approaches to tackling climate change. Camille now coordinates the Lancet Countdown's policy engagement strategy, where GCHA has had the opportunity to work with her quite a bit, and where she works on translating those academic findings into policy influencing products like policy briefs and data sheets. So with that, I'd like to turn over to you, Camille.
Thank you so much, Jenny, for that introduction. And I will share my screen here before I get started. Here we go. And again, thank you so much. So as Jenny said, I'm Camille Oliveira. I'm the policy analyst at the Lancet Countdown. And today I'll be talking about the essential role of evidence in policymaking. So first, I wanted to start with an overview of health impacts of climate change. And if you were here with us last week, you would have seen this same slide from my colleague, Maria Wallawender. And if you weren't at that webinar, I would highly recommend you to watch the recording, because that presentation goes a lot more into the specific evidence that we have. But for those of you that weren't here last week, just wanted to put everyone kind of in the same page. So in 2009, there was a Lancet Commission that brought together to study the intersection between climate change and health, and found that climate change is the greatest global health threat facing the world in the 21st century. And how does that happen? How does climate change affect health? Well, with the rise of global temperatures, we have higher risks of floods, heat exposure, poor air quality, land use change, and a variety of other effects that then causes people to have heat stroke, higher rates of infectious disease, and poor mental health and malnutrition. And sadly, it is usually those that are most vulnerable that will feel the worst impacts, as these are exacerbated by age or access to services, as well as socioeconomic status. So it is very clear from both a report and this diagram that puts it very clearly that climate change is a health issue. And this sets the background of Lancet Countdown as an organization. So we were created to track the impacts of climate change on health over time. Our first report was in 2016, and since then we've grown to a group of nearly 300 experts worldwide that are putting together this report every year. Last year, our report had 50 indicators on the topic. But what do I mean when I talk about indicators? And to give you a deeper dive into what is it that we track? Indicators are different kind of topics that we cover. And these indicators are divided into 5 working groups. And these 5 working groups are, at the center, we have the health impacts of climate change. So for example, heat and health and extreme weather events and tracking food insecurity. We then have, related to that, we track health adaptation. So how ready are countries and their health systems to respond to climate change? We also have the health benefits of mitigation. So what would be the benefits of a clean energy transition, of healthy transportation, of clean air on our health? And surrounding all of this, we have the economic impacts of climate change and health. So we talk about the economic losses due to heat-related labor reduction, and as well as how much countries are subsidizing fossil fuels. And finally, we have the political context, so tracking countries' engagement with climate and health. And this kind of provides an overview of the types of evidence that we can provide to help people's advocacy. So does health and climate change equal more ambitious action? That is the rationale that we use behind our organization. And the reason for that is that we find that health is a unique entry point and a motivation for more ambitious climate action, because it makes climate change more relatable. It puts a human face onto climate change in a way that is not, climate change isn't something that is happening in the future. It is not something that's happening out there in other countries. It is affecting us today. And not only that, but we also, with our indicators and our evidence, we want to highlight the huge opportunity that we have to improve people's health by creating healthier cities with cleaner air and active transportation. And at the same time, that will have a positive impact on like climate mitigation or climate adaptation. But not only that, the importance, and I guess of the evidence that we produce is, like I said, we're a collaboration of researchers and academics around the world, and the voices of scientists and medical professionals who we work with are some of the most trusted in society. So using Lancet Countdown data brings sort of credibility to the issue, and may sway audiences that wouldn't be swayed by the environmental argument. So what do we produce? And how do we translate those academic findings into policy relevant documents? So we have 3 types of documents, and our goal here is to be knowledge brokers and to equip partners with the data that can be used in their advocacy to push for more ambitious climate action. So we're producing the data. We are not necessarily advocating and working with people every day. This is why we love to work with everyone, people like you in this call, with these documents so that you can go out and be better equipped to talk about climate and health. So we produce policy briefs, and we have Anka here who will talk about and we'll talk about the impact of the policy briefs on a country level. And these policy briefs provide a more in-depth look at certain recommendations. And it's quite a longer document with some of our data as well. We are shifting now towards a more, I guess, a shorter form and more, a shorter form of policy products. So we have the data sheets that are a country level overview of indicators that we have. And it's just a 2-pager, and will provide a lot of some key evidence on climate and health that will help push that you can use in your advocacy. And lastly, we're shifting towards policy priorities document from the policy briefs that are just a 2-pager and kind of more a quicker look at certain recommendations. So they're much more succinct, I would say, and that's kind of where we're shifting now. So how could these be relevant to policy influencing and policy making? Well, I'll talk here about policy influencing in 5 steps, because in a lot of times the term policy making and policy influencing gets thrown around a lot. What does that actually mean? So here are kind of high-level steps that you can take to developing a policy strategy and where you can use the Lancet countdown data. So first step is to define the issue. Why is climate change and health an issue? And we have, from all of our reports, a lot of very key evidence that will help define and frame the issue. And in terms of articulating the goal, you can use both our policy briefs and our upcoming policy priorities documents to provide kind of a starting point in terms of recommendations and potential goals that you can have in your advocacy. Then you move on to understanding your specific context that you operate in. And this is where the data sheets come in very handy. It provides very high level overview of climate change and health in your specific country. And we don't have these available for all countries, but we're year by year increasing the number of countries that we produce these for. From there, you would identify key decision makers that would be able to implement the change that you want to see and the goal that you've articulated. And you have a different methods of engaging with them. So in engaging, you'll also monitor your engagement and continuously learning to see what is effective and what is not. And where we come in here in terms of monitoring is that our data is produced every year. So you have a way to track any progress, or most likely the lack thereof. And so every year you can do that. And in terms of learning, we have a lot, we recognize that policy engagement doesn't just happen at a global level, but also at a regional level. So we have regional centers all over the world that provide, not only do they have their own reports, but they also provide more relevant information for the regions based on specific vulnerabilities, the political context, and the opportunities for the region. So I would really encourage you to look at the regional reports that we have this year. We've had the Europe report, the Latin America report, and the Oceania report, and we have a small island and developing states report coming in August. So these regional centers are best positioned to collaborate with, if you're working in a specific region, they would love to collaborate with you, and are best positioned to affect change to local partnership and local action, because that is where a lot of change can be made as well. And finally, during the launch of our global report, which happens in October, November time, we also have launches in specific countries, and there we will bring policymakers and other voices to talk more about the local context, so you can continuously do that learning throughout your policy engagement process. And I just want to do a quick shout out. We have a Brazil launch happening next Wednesday on July 3rd at 9 a.m. Brasilia time, but it's also an in-person event. So if you just happen to live in Brasilia, feel free to come along, and I can put a link in the chat as well. And that comes to the end of my presentation. That was a lot of high-level information, but we have here a speaker that will bring this to a local level, and I can go through in the Q&A section of where you can find these resources. But my time is ending, so I'll just hand it back to you, Jenny. Thank you.
Thanks so much, Camille. And I see that there is a question in the chat. We'll bring that question in during the Q&A time. I should also mention that our third presenter, what the ripple effects may be. Could I, thank you. If folks could please be conscious of staying on mute until we get to the Q&A, that would be great. So thanks so much, Camille. That's a really fantastic overview. There's already a question about where people can get a hold of some of this, and some questions to understand the data better. So we'll bring that up during the Q&A period. I should also mention that our third presenter, Professor Maisim Tabatabai from Malaysia, is meant to be with us. His flight was delayed. We're hopeful that he may be able to join kind of halfway through the event. If he does, we'll find a way to bring him in. So I'm asking our audience to be a little bit flexible because we'd love to hear from him if he is able to join us. Okay, but now I'd like to turn over to Anne-Catherine van der Haar, who is a research associate at the Center for Planetary Health Policy, a Berlin-based think tank working on the nexus of global environmental change and health. She's a trained medical assistant, holds a bachelor's and master's degree in public health, and is currently pursuing a PhD in planetary health at the University of Halle, Germany. As part of her work at CPHP, she coordinates and organizes activities to place the Lancet Countdown report findings in the national context, especially targeting political decision makers in the German health sector and beyond. So moving towards making that kind of link with policymakers. Let's hear from you, Anne-Catherine.
Yes, thank you so much for the kind introduction, also for the invitation, and also for Camille, your presentation, because it fits very well to what I'm going to present. And as Jenny just pointed out already, I'm a research associate at the Center for Planetary Health Policy, and we are kind of the organization that coordinates and organizes all the like local. Yeah, you're not mute. Oh, thank you very much for muting yourself. Perfect. So as I said, we are the organization that really does this local, national engagement of policymakers, and really trying to, I have the aims on the next slide. I might just gonna switch it already. We really aim with our initiative at the national level here in Germany to raise the awareness for the super important Lancet Countdown reports findings global, but also, of course, for the European report here in Germany, and really place the findings into the German context. So really look into what does it mean, what implications do we have, and thereby, and based on that, really formulate what concrete needs for action and recommendations we have for the German health policy sector, but also for practice. And starting off, to give you a little bit of background about the cooperation or the initiative here in Germany in general. And as I said, CPHP, but actually by that time it was in 2019, where the initiative was initiated by KLUG, which is the German Alliance on Climate Change and Health, and CLUG is actually the NGO that the Center for Planetary Health Policy is tied to. We're kind of the same organization, just different arms of it. And so they kind of initiated the cooperation in 2019. And just as a side note, CLUG itself got founded in 2017. It was really tiny organization by that time. And they just came at the right time and really tried to start off this cooperation with different organizations coming into place. And since 2022, the Center for Planetary Health Policy is the one coordinating the whole process that CLUG was setting up. And to give you a little overview, who is part of the cooperation, we on one hand have a lot of well-known and very established research institutions here in Germany. You probably won't know most of them, but there, for example, is the largest university hospital on board, which is the Charité, but also the PIC. Some of you might know that one. It's the Potsdam Institute for Climate Impact Research. So we really tried from the beginning on to have like an interdisciplinary consortium. And on the other hand, which was also very important for the whole cooperation, CLUG was managing right from the beginning on to also get the Nursing Council, which you can see on top, as well as the German Medical Association. In German, it's Bundesärztekammer. You can see it on the right bottom of the slide. And that was a really big deal, as this is like really the professional organization that is doing things in interest of all doctors in Germany, because every doctor is a mandatory member of the Medical Association in Germany. And usually they are more known of being conservative, and before 2019 they didn't really had anything to do with climate change and health. There were only like a very few people that were pushing that topic forward, and it was a bit of luck actually that the organization did join the cooperation from the beginning on, and it was like due to the very few people that pushed it very much within the organization, and also the factor that the initiative was linked to the Lancet as a well-known and prestigious medical journal really made a difference at that point. And since then, the cooperation since 2019 is very stable, and just a few other institutions came in and got out at some times, but it's a really strong network ever since. And just to give you a little bit of overview, I mean, Camille said it already, what things we're doing on the national level, but maybe I'm just describing the formats and products we're using mostly a bit more in detail. So since 2019, we have been planning and conducting launch events accompanying the publication of the global, but also the European Lancet Countdown reports. And starting with the COVID year in 2020, the launch event were usually taking place in a like 2-hour online format. You can see a screenshot of one of the launch events on the slide now. And the concept was always quite similar. We usually had a Lancet Countdown author with us that introduced the most relevant scientific findings. And then we really tried in the rest time to bring experts from science, from administration, from practice, but also from policy in Germany together and discuss what this all means for the German context. So which are the implications, what are the most important focus areas for the German context. And in the last years, we were trying to get also other disciplines apart from the medical and like public health sphere and profession and sectors on board. And for example, at the last launch event, we really had also an economist with us from the energy sector. And this is like really, really cool to also bring other people in. And from 2022, and that's quite a big success for us, and it got a bit of a tradition that the German Minister of Health is actually holding the opening talks for the events. And usually around 200 to 300 people are attending them. And this year in May, we actually had our first in-person meeting. or event for the European report that got launched just before, and that we organized with the University of Heidelberg. And that was also really cool, because for the first time we didn't stop at like national level to really, but we really also tried to bring the findings down to local and state level. And we received a lot of cool feedback and further cooperations out of that. And in 2020 and 2022, we also additionally held federal press conferences. And in 2022, the Minister of Health was also attending that. And as Camille also described already, in 2019, 2020, and 21, we also drafted policy briefs for the German context, where we focused on, every time we had 3 different topics or focus areas that the contributing experts found most important for the German context. And that was, for example, nutrition, but also heat or the CO2 reduction of the German healthcare system. And we really tried to push those different topics within the policy briefs in these years. And the 2021 policy brief was actually quite special, and I want to highlight that one especially here, as the authors decided to pick up on the 2019 identified focus areas, and they really tracked the recommendations that was made 2019 in the policy brief, and looked what progress was made for the German context. And since then, latest, we have actually been very, very involved and busy working in the field. And that's also one reason why we didn't do another policy brief, but we're currently preparing one for 2024 to come out with a bigger consortium and trying to follow up on the recommendations that we have made. And lastly, one success story that I would like to tell you briefly, even though I'm of course acknowledging that it's like really hard to measure and prove political impact, as it's of course usually a matter of multiple dynamics that like come together. But I think the following example, and I'm trying to like explain it in a very simplified way, we can quite precisely say that we made a big contribution to that development. And so I've shown you the 3 policy briefs in 2019 to 2021 already. And one thing they all 3 have in common is that they all put the topic of heat and heat adaptation for the German context in the focus of the 3 policy briefs. And already in 2019, the policy brief actually recommended for the German context that there needs to be a national heat protection plan, because by then the health sector, for example, or especially, was not part of all that of heat adaptation at all in Germany. And so they really found this super important, and this recommendation was taken up further in the policy briefs and was intensified in the 2021. And luckily, the cooperation partners and of course us did a very great job in distributing this policy brief and really bringing it targeted to the Ministry of Health. And we thereby got a lot of attention and awareness, and a lot of other organizations just realized that this is a super important topic and joined us with our forces to really push that topic. And so more and more initiatives came up and resulted from that. And for example, in 2022, Klug and also the Medical Association, who was part of the cooperation from the beginning on, they founded an action alliance on heat adaptation for the city of Berlin, and then followed for other states and cities in Germany. And thereby, as a result, the issue became bigger and bigger, and more people and organizations joined it all. And the Ministry of Health couldn't ignore it any longer, actually. And since 2022, we are part of consultations that came up and kind of invited us to be part of it. And finally, in 2023, the Minister of Health actually announced national heat adaptation plans to come up this year, and they're still drafting all of this. And Klug is luckily a part of the committee who is advising this whole process. And lastly, I just want to give you some key lessons learned that we found in like the German cooperation and work that we've been doing. So first of all, it's crucial and very important that you have people that know the field. I really find this to be a key to find windows of opportunity, and not only meaning that you know and understand the actors' interests and roles and maybe possibilities that are in the field, but also understanding how political processes work and how political decisions are made. And luckily, Klug and the diverse cooperation had that from the beginning. I think they really had a good, right instinct, I would call it, and probably also a bit of luck that it really led to this political momentum. And also just mentioning that you, of course, always have to think about who's my target group, and you really need different formats for different target groups. And also translating or breaking down the scientific findings is very crucial to do this at national, but also state and local level. We really learned this year especially. And it's super important to formulate what it really means and which gaps and priorities are there and what should be done first. And what we also learned is that good practice examples actually work quite well in that context. And lastly, and I think you can tell by my presentation already, it's super crucial to build transformative alliances. And therefore, and this is what we did with the medical association, but also with other stakeholders that come in and out into the cooperation. And we really try to have this unusual players from other sectors or like more established people being part of the cooperation. And another fact that is super important is that change agents can change a lot, but not alone. And so the transformative power is really way bigger when we learn to bundle knowledge, skills, networks, and people. And also a very important point at that cooperation was always to have the sense of community, to really get motivated by the power that the people bring into the cooperation. And lastly, and I think that's very clear, but relationship building is really key in that context. It sometimes takes a lot of time. It's really frustrating, and you really need to be persistent and sometimes also annoying by addressing policymakers. And it sometimes also makes sense to not like come into like open the door and come in there like really directly with the topics that we actually want to talk about, like system change and fossil fuel phase out. Sometimes you have to do it a bit more soft and a bit more slower and really build this relationship first and then come to them with those topics, because some political decision makers just shut down when you bring those huge topics, even though they're important and you need to push them forward, but you need to be a bit diplomatic, I think, in that sense. And yeah, also like using indirect channels work quite well. For example, what we did with the medical association was really important to get players on board who are recognized by political decision makers to make it just bigger. And that's just a few lessons learned. I could probably talk longer than that, but I think I'm running out of time. So thank you very much for listening. I'm excited to hear your questions, and thank you.
Thank you so much, Anne-Catherine. Really great to hear like a concrete example, and especially to hear a concrete example of success, of successfully influencing policy. It's also been really impressive to see the work that Klug and the center have done in the period of time that you've been around, and really building those partnerships and building that capacity to have that kind of influence. So well done, and really nice to hear about that work. Okay, we our third presenter has heroically made it from off of his flight and to a stable location to be able to join us. And so it's my pleasure now to introduce Maisem Tabatabai, who is a professor of environmental technology at University Malaysia Terengganu in Malaysia. He's a leading expert in waste-oriented biofuels, collaborating with UNDP and serving as a lead collaborator for the Lancet Commission on Health and Climate Change. There's more I could say about him, but in order to give him more time to present, I'm going to go ahead and turn over to you, Maisem. So please.
All right, thank you, Jenny, for a introduction. Yeah, I just found the cozy place for it. After 2 days, all canceled, but luckily I made it. So thank you so much for the.
You're cutting in and out a little bit. I wonder if it might be worth turning off your video.
Okay, so all right, so let me use the other because okay. Just a moment. Is it any better now?
We've got you with an echo now. So I think you need to turn off the audio on your device.
Okay, how is it now?
That sounds much better. Yeah.
Okay, great. So I'm using two devices at the moment. I'm listening to and speaking to you using my mobile phone, but watching you through my laptop. Okay, so all right. So let me get on with this. All right, I assume you have my slides on, right?
Yes, we do.
Okay, fantastic. So it's always great to be surrounded by people who care about our future. And thank you so much for giving me this opportunity to be with you today. All right, so I'm gonna skip the introduction. I have been with the Lancet Countdown for the last almost getting 10 years since 2016, and so I have been leading the food security and nutrition indicator, and I have organized the last 5 years of Malaysia launch of the Lancet Countdown report. I have initiated collaboration with major Malaysian non-governmental institutions in the field of public health, namely Malaysian Medical Association and Academy of Medicine Malaysia, to collaborate with the Lancet Countdown events in Malaysia. And finally, I organized the last Malaysia launch in collaboration with Commonwealth Medical Association, one of the largest international organizations in the field of public health, and with 500 participants in person across 7 countries. So I think many of the topics that I'm presenting as introduction must have been covered by my colleagues before, by Anka and Kemal, but I just go over very quickly. I think everybody knows that evidence-based policy making is probably the best approach, and that requires best available research and data. So it's debatable what is best available research and data, but there are indicators through which one can identify those. It's important for policies to be grounded in in such medium, best available research and data, and that's probably the only way we can guarantee more efficient outcome and more efficient use of resources. Complex issues probably require more of such. And climate change and health is one of those very complex issues that we are facing as a species, I believe. And we need strategies that are scientifically validated. And we can't take any risk here. They need to succeed. So the Lancet Countdown is arguably one of those resources, consistently providing evidence, good quality research and evidence on climate change and health. We have been providing credible data and analysis with an aim to inform policy decisions globally. And one of the indicators here is how widely we have been reflected in global media, the policies we have affected around the globe, and how widely they have been quoted by key figures in the field, the highest level literally possible. So now I'm getting down to Malaysia, what we have been doing. Over the last 5 years, without missing a year, we have been organizing Malaysia launch of the Lancet Countdown. We have been effectively trying to disseminate critical findings on the impact of climate change and health. In order to be effective, so we have been trying to get key stakeholders engaged. And that's very, very important. And that include health professionals, policymakers, researchers, and international organizations. So in the launch events, they have been trying to present the Lancet Countdown data and research in creative ways. I'm going to share some of these with you in the forthcoming slides. And we have been trying to influence policy and strategies of actions in the country. Sorry about the background noise. I can't help it. It's airport anyway. So, and you can see here one of the very first Malaysia launch events, 2018. This picture, you can see different walks of the society here, from police officers, from member of the military to academicians. All right, so this is the Malaysia launch of the Lancet Countdown 2019 report as well. So what we have been trying to do is trying to be innovative, as I said. We have been trying to get out of the box, be different, not just be scientists, be communicators. We have been trying to create a vibe for more engagement. This one, in this year, 2019, we ask mothers and the newborn to be present in the Malaysia launch. So we had a nice spectrum of babies of different gender participating in the launch. And during the event, we asked the mothers to stand, to rise and show their babies, because these are the people, these are the generations or members of the next generation which have no voices in whatever policy we make today. We make policies, we make strategies, we develop and implement them for these people, and they have no voices at all. So it was amazing when the babies were around. We could touch hearts during the event, and our findings were way more highlighted than we expected. This is what happened in 2020. So we step up. We try to engage more, influential figures from the political arena. So we got involved, the Minister of Higher Education in Malaysia. So the event was officiated by her, and she continued to do that for the following 3 years. So 2021, 2022 were also officiated by the Minister of Higher Education. And that basically highlighted our efforts to get into the education arena. It's very important. I personally believe without getting the education, facilities, education body involved, we can't address any complex issue, including climate change and health. So politicians are important, but you have to look at the context of the country, the social context of the country that you're advocating. So Malaysia is a kingdom, and the royal family is respected by a large fraction of the society. So we try to identify uh, members of the royal family who are also very much caring about the topic climate change and health, the environment, education. And we approached Her Highness Princess Zatasha, the daughter of the Sultan, who happened to be a very popular activist with thousands of people, tens of thousands of people following her on social media. And she appeared during the launch. And she promoted the event on her social media, and that really made a difference. So we just didn't go for some scientists all the time. Scientists were, the core. Data and good research was the core, but that was not enough. We needed other elements to attract the mass, the population, the general public, because at the end of the day, we wanted to generate public awareness. And in 2023, we really stepped up. Probably 2023 was one of the best because we teamed up with Commonwealth Medical Association. As I said, its jurisdiction extends over 54 countries in Southeast Asia, Oceania, and Africa. And with Commonwealth Medical Association and its influence, we managed to get through deeper layer of the policy making in the country. And the event was officiated by Deputy Prime Minister of Malaysia, with 500 people present in person and delegation coming from 7 Commonwealth countries. So I want to present to you this one. I think Malaysia launch is unique from this perspective. They have voices and aspirations of the next generation. I don't know whether you can hear.
We're able to just hear the music. Lovely.
Wonderful. Yeah, that's a short one, but you can watch the whole event. Sorry, I'm echoing, I think. Yeah, so you can watch the whole event on YouTube. So we stream every event on YouTube and Facebook because there are different, group of people attracted to different platform. You can't miss any. So we had kids as a part of, our events unconditionally in the last 5 events. So all of them, uh, they played a role in different ways. In 2022, we organized a joint performance between kids in a school in Colorado Boulder and kids in schools in Terengganu. So the collaboration was mesmerizing, was fascinating. That kids in 2 different time zones, 12 hours apart, and different culture appeared on the stage together and promoted the same message. That was really interesting for me as a person. All right, so the outcomes that I can list, we tried our best to increase awareness and enhance engagement by basically, getting different stakeholders from across different sectors, health, environment, academia involved. And you can see a list of them here. So we try to basically influence policy. A notable example of the efforts that we put in there was the development of the Lancet Countdown Policy Brief Malaysia in 2022 for the first time. And we got Malaysian Medical Association and Academy of Medicine Malaysia. For your information, these are the 2 major bodies in the field of medicine in Malaysia, literally covering everyone in this industry, medical students, you name it, hospital staff, doctors, specialists, everybody is under the umbrella of these 2 organizations. So in the policy brief, we use the Lancet Countdown data, but we try to be practical. We try to provide actionable insights and evidence-based recommendation to advocate for ambitious climate action in Malaysia. We try to enhance the already in place government policies. We try to add to them. We try to commend the government for what it had been doing before that, and try to offer some uh, fresh insights. So some of the challenges and lessons we have learned, I'm going to walk you through some. So I have listed challenges that we have faced here. One of them, probably the most important, was engaging with the policymaker. That's intimidating for many scientists. They try to avoid, but it's important to approach them, despite the fact that sometimes they are slow in adopting science when it comes to climate change and health policies in particular, but it's possible. You should never give up. Public awareness, sometimes you're surprised by the limited amount of public awareness about the links between climate change and health. And sometimes you are basically blocked by other pressing public issues. There is a competition there. When you want to generate awareness, there are many issues the public are concerned about. So you have to find a very good strategy in order to overcome this challenge so your topic can prevail. Data accessibility and utilization is another one. It's very important to put your data in the local context. In a nationally available data is important, but you have to make sure that it is put into local context, and that's a challenge. Resource constraint is another challenge. Lack of funding and human resource for your advocacy is something that you will face, and we face, and we try to look for different alternatives to overcome this. And the lesson learned, so how we try to address these challenges, we try to build a stronger network. And the example that I presented, the collaboration with MMA, AMM, and CMA was an example of how we try to enlarge our network to make it more influential. Effective communication is key here. You have to tailor make your communication strategies to different audience. I presented to you the dance, the dance performance was not just a dance, it had a story to tell. It was about the environment. So all the presentation, all the performances were really thought about, rehearsed substantially before the event in order to make sure that the message will be conveyed. And remember the kids that we brought, the newborn that we brought to the event. Telling your success stories is important. Tell your audience about how the Lancet countdown data has made a difference, and that's going to make your effort more relatable. Adapting to local context, I think I stressed that one enough, but that's really key. Is missed in many efforts, and that could be a reason that those efforts might fail. And you have to continuously learn from what you're doing, and you have to be very flexible, and you have to try to keep adapting to the new environment and to new reality. And looking forward.
Maysam, I wonder if perhaps we could leave it there, because I would like to be able to take one or two audience questions. I'm sorry to yeah, okay. We have a couple of interesting audience questions that, and that may give you a chance to kind of talk a bit about these things. So sorry to cut you off there, but I would like to get to a couple of our audience questions. Thanks so much for that excellent presentation. And I was particularly struck by your sentence, that your phrase that you strive not just to be scientists, to be communicators. And that really comes across in everything that you shared. Okay, I'd like to take a couple of quick questions. I'll ask two questions initially. The first, and it's there's been a response in the chat, but I think it'd be great to hear it out loud, is the data publicly available? Where can people get these resources? So that's one question. The other question, and this is quite interesting, have you analyzed the differences in entry points for influencing policies regarding governments with different models of government and different types of legislative organization, whether national states or without nationals? Do you have any experience or comparison from different strategies for these different situations? So I don't know if Lancet does any of that sort of comparison, but we have a couple different examples of different contexts here. So I wonder if our speakers might have some thoughts on entry points with different types of governments. So let me put both of those questions out there. Maybe Camille, you would want to speak about where the resources are available?
Yes, I will share my screen really quickly and show you on our website, and I can put a link in the chat as well of where you can find this information. So you have lancetcountdown.org. You can come here under resources and policy briefs and data sheets, and you can have access to our policy briefs and data sheets all here, and other resources that we have available as well. And these are all publicly available. And if you want to get more into our specific indicators, you can go into Explore Our Data in the corner here, and you can go through each working group that I talked about and go into each specific indicator and find each of the findings. And for some of them, you'll be able to click sorry, my internet is, you'll be able to click through the countries as well to see country level information. My page isn't loading right now, but I would encourage you to go and have a play with the different indicators. And I'll pop our link in the chat as well.
Fantastic. Yeah, and I think the country level data is really super useful for folks advocating at the national level. And Mesam and Anne-Catherine, I wonder if each of you could reflect on the question of entry points with different types of governmental structures, different, like what are those entry points in each of your contexts, and any reflections you have about how that might be different in different contexts?
I mean, that's obviously a very great question. And like, even from like the presentations Maisam and I did, I think you can tell that those two systems are very, very different, and that Maisam has done things very differently than we did in Germany. I mean, for Germany, it's a federal state, and we struggled a lot because the health system is organized quite self-governing, and it's really hard because that just scatters health policy a lot. And I think there the point of having people on board who really know the field and know the country very well is super important and crucial. And you need to do that nevertheless. So because we're running out of time, I'm just giving it to Mason for some additions on that.
All right. Thanks, sorry about the echo. I fixed it. Yeah. So yeah, exactly. That's totally different, and that's there is no silver bullet, as they say. So here in Malaysia, it's very important to get through celebrities, because in order to be heard by the politicians, you cannot approach them directly. You won't be heard. So you have to create a momentum here. So that's why we go through international organizations. They like international organization involvement. So when we team up with CMA, our penetration, strength, power tripled. So we could easily make an appointment with the Deputy Prime Minister. We could secure his time. But without them, it was absolutely impossible. And through celebrities, through royal family is also important. As I said, you have to understand the context. The royal family is respected highly here. So if you go through them, but you have to identify which royal, not every one of them. We have to understand that they should be on the same page as you are. And I think our efforts, were more or less effective because we try to understand that context. Thanks, Jenny.
Thank you so much. Thanks to all of our excellent presenters. This was a really fascinating session. Really appreciate all three of you. Extraordinary to see the work that you're doing, the changes that are happening, the creative strategies to build momentum and to get through and actually reach policymakers. So really wonderful to hear from all of you. So GCHA's next session is still in the process of being scheduled. So we ask everybody to stay tuned. We'll announce what's coming up next in the coming days or weeks. And it will focus on the implications of the recent World Health Assembly and the subsidiary bodies of the UNFCCC, the meeting in Bonn that was a little bit ago, and what the outcomes of those two meetings mean for climate and health. So stay tuned. That's in the process of being scheduled. Thank you again to all our presenters. Thank you again to Mesam for coming on, even though you just got off a flight. And thanks to our interpreters and to Milena for organizing this excellent session. And everyone, wishing you a good rest of your day or your evening.
Thank you so much, everyone. Bye.
Yeah, thank you, everyone. Have a wonderful time. Bye-bye.